Hello, everybody. This is Dr. Andrew Campbell. I'm giving you another presentation based on medical evidence, not on what people say on the internet or otherwise. So the internet is basically full of people's opinions. This is what you should do, but there's no evidence that that actually works from published studies or medical centers, etc., that have researched it. On the contrary, I've researched it, I've got it all going, and I'm going to give you where this information came from. So this is how mycotoxins affect the neurological part of the human being. So this is who I am. I have not had the time yet, but I just was invited to and became a member of the editorial board of another journal on top of all these. So anyway, forgive me. The objectives are to understand the evidence in medical science, how mycotoxin cause neurological problems, what is the mechanism, how does that happen, in other words, which tests are helpful, and what tests don't have any real medical evidence. So how to deal with problem solving and caused by toxins is number one, find out what it is. What is causing you to feel sick, the patient to feel sick? Second, find that cause and then remove that cause and then repair the damage. It's as simple as that. I've published over 100 studies. I have chapters in medical textbooks. It's easy. By the way, this was on Scientific American on the cover of it, and you can see it's mentioning the next deadly plague, and believe me, it's not as far in the future as you think. What's happening is there's a lot of climate change, and you can see that window that's moist and it's got mold on the sill, etc. Okay, so now there's a lot of floods everywhere. We read about it in the news almost every week. And so these get into homes, businesses, schools, public buildings, apartments, etc. Mold starts growing, and mold releases spores, and these mold spores in the air carry with the mycotoxins, which you breathe in or absorb through the skin. Two important points regarding mycotoxin. A mold that produces mycotoxins, that produces a series of mycotoxins rather than just one mycotoxin, okay? So it's not like Aspergillus produces this mycotoxin. No, Aspergillus will produce several different types. For example, there's over 250 species of Aspergillus. There's over 350 species of Penicillium, etc. So one mold produces many different mycotoxins, and if there's one mold that produces mycotoxin in a home or a building, then the mycotoxin it produces is also present. Exposure is mainly by inhalation and through the skin. It's not from food, and I'll show that later on. So just as you know how small it is, here is 100 microns thick. Mold spores are 10 to 20 microns thick, and mycotoxins are 0.1 microns thick. What do? They inhibit the synthesis of RNA and DNA. They form DNA adducts and protein adducts. These bind to human tissues and cause autoimmune diseases. They cause oxidative stress, which is inflammation, causes a lot of inflammation. They cause mitochondrial-directed apoptosis. The mycotoxins attack the mitochondrial cells, cause them to be dysregulated, and the cell dies. Apoptosis is cell death. And mycotoxin antibodies form adducts that, as mentioned before, and these attach to human tissue and start an autoimmune process like autoimmune thyroiditis, Hashimoto's, and various other disorders. We'll look into that in just a few minutes. So the overwhelming medical and scientific evidence shows that it is the brain and nervous tissue that is affected first by mycotoxins. If you look at that figure and you see those two tubes coming out of the brain right where the eye is, those are your two olfactory nerves. the nerves that smell. They're the closest ones, and it is known and has been shown that mycotoxins, that's where they get into your nose and then get into through all the nasal mucosa and bones and go directly into those two olfactory lobes. So remember, there's 22 bones in the skull, and they get through all that. Mycotoxin antibodies bind to human tissue, as I mentioned before, causing autoimmunity, but they also bind to nerve tissues like myelin, and they trigger, and this is well known, they trigger demyelination. So here's a healthy brain scan, and on the left, and the toxic brain scan on the right. This comes from Dr. Daniel Amen, who is the whiz with SPECT scans. These are single photon emission computerized tomographies. I've had the privilege of knowing him for like 30 years or so, and he is a brilliant man. So what are the neurological effects of mycotoxins? Autism, decrease in short and long-term memory in adults and children, optic neuritis. I published a study on this, optic neuritis, and how to treat it, how to recognize it and how to treat it. Chronic inflammatory demyelinating polyneuropathy, that's known as CIDP. Loss of balance, facial pain, multiple sclerosis, ALS, which is also Lou Gehrig's disease, Alzheimer's disease, Parkinson's disease, movement disorders. So, neurocognitive impairment. People with a documented history of chronic mold exposure can display a wide variety of symptoms, and these include severe fatigue, malaise, and severe neurocognitive impairment. This is from the study that was published 7 years ago. And here's another study that was published, and this one shows that chronic fatigue syndrome, fibromyalgia, and hypersensitivities, people with hypersensitivities, allergies or food intolerance, or they're very sensitive to chemicals at concentrations that most people have no problems with. They're sensitive to EMF, electromagnetic fields, and even to daylight may be associated with mycotoxins. Okay, and some of the symptoms experienced by patients with advanced mold-related illness, such as fatigue, memory, cognitive impairment, and sleepiness, somnolence, are those like reported by the silicone breast implant patients. Yes, I've published 23 studies on silicone breast implants, and you can go to MyMycoLab's YouTube channel and watch the various breast implant webinars I've given there. So here is another statement: the effects of mycotoxins. An occupant of a water-damaged building may experience musculoskeletal pain, muscles and joint aches and pains, fibromyalgia, gastrointestinal problems, and symptoms of autonomous dysregulation of the nervous system. That's where you get your POTS from, P-O-T-S, all capital letters. I'll show you that in just a moment. So, for example, here's T2 toxin and deoxynivalenol. Deoxynivalenol is also known as vomitoxin. So I put vomitoxin for simplicity, and it's shorter. Vomitoxin disrupts the central nervous network, including neuroendocrine and growth hormone signaling. Notably, the contamination of molds and mycotoxins has been found in Alzheimer's disease. I'll show you more of that. Vomitoxin can affect the normal activities of the nervous system and the endocrine or hormonal system, and then cause damage to brain cells. And then T2 toxin change the cellular structure, the actual structure of cells and function in the brain. So they're also related to the disrupting the function of the central nervous system, the brain, and peripheral nervous system. This is in your arms, your legs, your glands of internal secretion, thyroid, and parathyroid, adrenal glands, etc. And mycotoxin can cause the development of autoimmune thyroidal disease and type 1 diabetes mellitus. So the mycotoxin disrupts the brain's nervous network, including, I'm sorry, we already went through that. So in one study that I was involved with, and it's a chapter in a medical textbook called Advances in Applied Microbiology, volume number 55, 91 out of 119 patients, in other words, 83%, had peripheral neuropathy. How does that present? Numbness, tingling, tremor, muscle weakness. And these showed significantly higher titers of antibodies, all three, to neural antigens. What are neural antigens? These are nerve tissue, such as myelin basic protein, myelin-associated glycoprotein, ganglioside, sulfatide, oligodendrocyte glycoprotein, etc. So they chew away at the myelin. If you remember, the brain is usually called, gray matter and white matter. We're talking about the white matter, myelin. So what else? Chronic inflammatory demyelinating polyneuropathy, CIDP, which I mentioned a few slides ago. It's an acquired immune-mediated inflammatory condition and has been diagnosed in occupants of mold-infested buildings. So you can also get brain fog, tremors, jerking movements, spastic dysphonia as you try to talk, tic-like motions, and idiopathic paroxysmal involuntary movements. These symptoms may often be misinterpreted or overlooked, especially in cases when conventional anti-Parkinson's medication does not help. This is from a study published in 2020. So here's another one. In neuroinflammation, inflammation of the nerves due to mycotoxins will clinically manifest itself, and it can be either epilepsy, seizures, and thermoregulation problems. In other words, heat, how you feel heat and how you feel cold. MS, multiple sclerosis. Well, gliotoxin, a mycotoxin that MyMycoLab tests for, has been shown to affect and damage 3 types of cells in the brain: microglia, astrocytes, and oligodendrocytes. Here is another one. This is a different study, published in 2019. The resolution of multiple sclerosis by antifungal therapy, in other words, itraconazole, compromises a strong evidence that supports fungi's major contribution to this disease. Yes, mycotoxins cause MS. And here's another warning, because if you go to Dr. Google, give everybody glutathione intravenously and every other which way you can, well, these results indicate that glutathione promotes gliotoxin-induced cytotoxicity. It makes gliotoxins stronger or worse. Don't use glutathione if you've got gliotoxin. And by the way, that study is from 2006. It's been around for a long time, but everybody jumps at anything that's written on the internet and without researching it. So here's T2 toxin is able to cross the blood-brain barrier and accumulate in the brain. Gliotoxin, this is another study, shows, this is from 2021, gliotoxin toxicity increased in the presence of glutathione. Okay, so let's look at postural tachycardia syndrome, or otherwise known as POTS, chronic fatigue syndrome, myalgic encephalitis, and autoantibodies. How are they linked? Well, as I said from before, mycotoxins trigger the onset or exacerbation of chronic inflammatory diseases and autoimmune disorders. Okay, now here's a different study. Both POTS and chronic fatigue syndrome, myalgic encephalitis, were found common in people exposed to mold-contaminated indoor air at schools and or homes, occurring in 60% and 69% of respondents, respectively. So here's another study. This is from Tufts University School of Medicine in Boston from 5 years ago. They did tests on autistic children, ASD. They checked 87 urine mycotoxins, no singular, not one mycotoxin or group of mycotoxins was associated with autism spectrum disorder diagnosis in children. However, serum IgG and IgE levels are a more reliable index of long-term exposure, and that's the test that MyMycoLab does. So, frequent misdiagnosis. People think, oh, it's fibromyalgia or chronic fatigue syndrome or chronic Lyme disease, and we'll get into that one a little more, or it's depression, and the depression is resistant to medication, anxiety disorders, autoimmune diseases, POTS, dysautonomia, and demyelinating diseases. These are all due to mycotoxins, but people get diagnosed with these without looking for mycotoxins. So remember, I told you about how the brain is affected by mycotoxins. Well, this study, evidence for fungal infection in the cerebral spinal fluid and brain tissue from patients with amyotrophic lateral sclerosis. This is Lou Gehrig's disease. Our observations provide compelling evidence of fungal infection in the ALS patients analyzed. So let's look at Alzheimer. And this was published also. And different brain regions, including the frontal cortex, cerebral hemispheres, entorhinal cortex, hippocampus, choroid plexus, contain fungal material. Analysis of brain sections from Alzheimer's disease patients reveals that all are infected with fungi, and with that, mycotoxins. Fungal infection is also observed in blood vessels. This is at autopsies of patients who died and who also had Alzheimer. So there you go, Alzheimer, and you get it from mycotoxins. And this is a case study. This is a 76-year-old Caucasian man. 3 neurologists confirmed that he had Alzheimer's after conducting tests and imaging. He didn't know his bedroom, where his clothes were located, couldn't leave home without getting lost, didn't recognize friends or relatives, was very forgetful. And the MRI surprisingly showed mild cortical atrophy instead of either moderate or severe, just mild. Well, at 76 years old, most people have a bit of cortical atrophy. On examination, his MMSE was abnormal. And on neurological examination, his deep tendon reflexes were diminished all over. He had poor balance. His gait, when he tried to walk, was unsteady. When I shined the light in his eye, the pupils were slow to react. Otherwise, the physical was normal. Heart, lungs, abdomen, all okay. I did an Alzheimer blood screen test called by Cyrex Laboratories, called a LINX test, L-I-N-X, and it was normal. No signs of Alzheimer. Here's his test results. As you can see, just at looking at it without reading every single one, you can see that he's pretty high in IgG and somewhat high in IgE, but he's really high in IgG, indicating a toxic reaction. This is after treatment for mycotoxins at 6 months. He still has some, but at 6 months, he's much better. And guess what? He was able now to drive. He was able to recognize people. He could do anything he wanted to. I continued treatment for 2 or 3 more months after this, just to get these levels all the way down. So let me explain antibodies to you so you understand that. In medicine and microbiology specifically, which is the area of a branch of medicine known as infectious disease. In infectious disease, doctors deal with bacteria, viruses, pathogenic fungi, especially things such as pulmonary aspergillosis, and parasites. So we develop antibodies to these after an exposure or infection. And these are all 4 of them are living organisms. They're alive, they have cell walls, etc. So as I say here, number 1, an antibody to these 4 pathogens means sometime in the past you got infected, okay? But toxins like mycotoxins, like mercury, like arsenic, like glyphosate are not alive. They don't have cell walls, they're just molecules. So what that means is antibodies to toxins indicate current immune reaction, not exposure sometime in the past. And once the toxins are gone from the body, the antibody reaction fades away. And this is what I showed you here, from this to this at 6 months. So then there's people who think it's all from food. Oh my gosh, it's coming from my food. Only in certain parts of African countries in rural areas and rural China, after harvesting with poor storage. Plant-based foods, meat, dairy products may contain mycotoxins in countries that don't have good food safety policies. I'll give you, for example, there are studies that show that milk, pasteurized milk, the kind you buy in the box-like thing at the supermarket, has anywhere from 1 to 4 mycotoxins, but they're all below what is called TDI, tolerable daily intake. What happens is not enough to affect anybody's health. It just gets peed out, and that's what the PP tests are test for, those types of mycotoxins. Okay, so like cereals, beans, and that includes beans or coffee beans as well, fruits, grape juice, all these things. And that's why you can find it in healthy people in urine, okay, and parts per billion, okay? I asked a scientist, not a scientist, he was actually a mathematician, what is a part per billion? I'm a visual, I need to see it. He says, take 100 football fields and cover them with golf balls. Once you have all 100 football fields covered with golf balls, remove 1 golf ball, that's 1 part per billion. So, folks, it doesn't mean anything. Food is not the source. And here's proof of that. This was published a few years ago. So look at the last 3 lines. An adult with a body weight of 170 pounds would have to consume 28 ounces of oat flakes, corresponding to about 14 pounds of ready-to-eat oatmeal, or 19.5 ounces of wheat, which is more or less 20 slices of bread. And this is rancid oatmeal, rancid bread. In other words, smells bad, tastes horrible, etc., in order to affect you. So no, you're not getting it from food. This is studies. This is evidence, medical and scientific facts. Binders. They work well in pigs, rabbits, sheep, broiler chickens, ducks, turkeys, rats, and mice. And that's in laboratories. There's no medical or scientific published studies to support their use in humans. There's not a single study that says this binder, you take this often, and you take this much for this length of time, or anything close to that. There are none, not one. Here is one that shows that it doesn't work. Binders rely on the absorption of mycotoxins from the gut, preventing it from getting into the bloodstream. That's the theory. And they include kaolinite, clays, activated charcoal, zeolite, bentonite, la la la. These are effective in neutralizing one mycotoxin, aflatoxin, and it's very rare to find this indoors. They are ineffective in all other mycotoxins. In addition, they also bind vital vitamins as well as macro and micro elements. We're talking, what are those? Zinc, magnesium, other things that we need. Okay, by the way, binders also interfere with all these medications. So if you're on thyroid medication, if you're taking high blood pressure pill, diabetic medication, hormones, for example, estrogen and progesterone, etc., they're going to bind those. It doesn't matter how far away you take it. If you take one in the morning, the other you take at night, it doesn't matter. So let's talk a minute about Lyme disease versus molds and mycotoxins. Both can cause neurological symptoms and different disease manifestations and multi-organ system pathology that can vary in either severity or how difficult it can be to diagnose. Okay. Here is a study that was published saying these tests are unsuitable diagnostic tests for Lyme neuroborreliosis. In other words, chronic Lyme and all these. So PCR is on this list, either on urine or on serum. Antigens in body fluids, the ELISpot, the VCS that is so popular on the internet. All those tests, this CD57 positive, bunk. It's all bunk. And here is how you treat it. You notice on the all the way on the right, it tells how long, 14 days and sometimes 21 up to 21 days. But there's patients out there who get it for months and 6 months of IV and all this, a year of it, 2 years, 3 years of treatment. Well, here's a study that came out this year, 2023, in the summer. Most patients who have Lyme disease respond well to antibiotic drug therapy and their disease resolves. If it doesn't, look for something else like mycotoxins. Okay, here's again 2 clinical trials in Europe of antibiotic drug efficacy. Only 2 out of 244 patients had failure, less than 1%. More than 99%, the 14 to 21 days was enough to make you well again. So if you're not well after 14 or 21 days of treatment with antibiotics, it's something else causing your problem, like mycotoxins. So which is the best test? I hear these huge, expensive tests. Well, this test costs less than half of those labs that love to tout their Lyme testing, and they spend a fortune in marketing it, etc. This is the multi-peptide ELISA test that's done by Immunosciences Laboratories in Los Angeles. It measures antibodies against different peptides that are presented during the life cycle of the bug, the bacteria, Borrelia, okay? And all the different types of Borrelia and all the different types of co-infections and those who have Lyme arthritis and neuroborreliosis, okay? And this is a published study. This is not a pamphlet from a lab. This is a published study. Here's another. Findings from those microbiological studies are substantiated by 5 clinical trials in the United States and Europe that have failed to show sustained improvement of this chronic Lyme with additional antibiotic therapy. It doesn't work. They got it wrong. Here's a publication I have that I wrote, Lyme disease and mycotoxicosis, how to differentiate between the two. All you got to do is send me an email, I'll send you the study. Common mistake I regularly see is healthcare practitioners who treat the lab test results and not the patient, especially for Bartonella, Babesia, and Lyme's. Just to let you know, Babesia, you have very exact criteria for that diagnosis. They're not being followed. And by the way, Babesia affects 0.0004%, okay, of those bitten by ticks. Bartonella, 1%. So here's evidence. Tests that lack medical evidence, urine testing for mycotoxins from indoor environment. It's from food. The oat test in urine for molds, it's sham. The genetic test, it's sham. There isn't a single study that shows any of these really work. Or the VCS testing, which we mentioned from a study. The MSH, melanocyte stimulating hormone, there's no evidence that has anything to do with molds or mycotoxins. And of course, two tests, C3A, C4A, they basically show if you have inflammation, but the inflammation can be caused because you had food poisoning, you ate too much pizza and beer or something. It doesn't point to Lyme or to molds or to mycotoxins. It just means general inflammation. This oat test, okay, it's used for rare inborn genetic defects of metabolism in newborns. That's at the hospital in the newborn ward. It's a useless test for molds. For healthcare practitioners, this is an excellent tool. This is just the first page. On the left, you put how bad it is. In the middle is what the symptom is. And on the right, when did you first notice this symptom? It helps weed out a lot of things. And lastly, treatment. First and foremost, the first rule of toxicology, get the patient away from the toxin or the toxin away from the patient. It doesn't work any other way. You can't get treated while you're still around the stuff. It won't work. You won't feel any different. So what's the take-home message that I'm giving here to all of you listening? If someone has been diagnosed with chronic fatigue syndrome, fibromyalgia, or chronic Lyme disease, and you've seen a number of doctors or clinicians, and you no relief, continues being sick, think of molds in the home or the workplace and mycotoxins. Mycotoxin antibody test may give you the answer you're looking for, and that's from MyMycoLab. So for a copy of the questionnaire, and here's two studies, the one on Lyme is at the bottom, but the other one is mold, mycotoxins, the brain, the gut, and misconceptions, which is a publication written by, co-written by me and Dr. Leonard Weinstock, who's a professor of gastroenterology at Washington University School of Medicine in St. Louis, Missouri. So folks, having said that, I wish you a great fall weather, and hopefully, if you have any questions, look up the MyMycoLab website. You'll get a lot of information, or look up mine. It's very simple, AndrewCampbellMD.com. Thank you, folks. Have a good one.